friends, today's our topic is cardiac diseases in pregnancy. Cardiac disease is now a leading cause of maternal mortality. It impacts 1 to 4% of all pregnancies globally. Its incidence is rising due to older maternal age and increased pre-existing conditions. Here I will explain physiological cardiovascular changes in pregnancy. In that, first one is increased blood volume. Blood volume expands by 30 to 50%, which peaks at 28 to 32 weeks. Next one is higher cardiac output. Cardiac output rises by 30 to 50%, which peaks in mid-pregnancies and labor time. Third one is elevated heart rate. The heart rate increased by 10 to 20 beats per minute. Next one is decreased resistance. Systemic vascular resistance drops, naturally lowering the blood pressure. Increase the stroke volume in early pregnancies. These changes may be poorly tolerated in women with underlying heart disease. Here I will explain the common cardiac conditions in pregnancy. The first one is congenital heart disease, most prevalent, affecting 0.8 to 1% of live birth, accounts for 50% of heart diseases in pregnant women. The example of congenital heart diseases are atrial septal defect, ventricular septal defect, tetralogy of Fallot, coarctation of aorta, and Eisenmenger syndrome. Next one is hypertensive disorders. Preeclampsia affecting 3 to 5% of pregnancies, significantly increasing cardiac strain. The third one is valvular heart disease. Rheumatic causes are declining, but degenerative valve diseases is on the rise. Examples, mitral or aortic stenosis. The last one is cardiomyopathies. Peripartum cardiomyopathy affect 1 in 2,500 to 1 in 4,000 deliveries. So these are the common cardiac conditions in pregnancy. Next we will discuss about the clinical presentations or symptoms. The first one is dyspnea, especially which occurs at a rest or lying time. Second one is orthopnea and paroxysmal nocturnal dyspnea. Third one is fatigue, palpitation and syncope. Fourth one is chest pain. And the last one is peripheral edema. So these are the clinical symptoms which can be expected in cardiac disease. Here we reach the diagnosis and monitoring aspect of cardiac disease. In that, first one is history and physical examination. The next one is ECG. In the ECG, we can identify arrhythmias and hypertrophy. Next one is echocardiograph. In the echocardiogram, we can identify the chamber size, valve functions and EF. Next, we will check the blood test, in that especially BNP, NT-proBNP also can be checked in order to identify the heart failure. Next one is fetal ultrasound. In that we can identify the overall growth and well-being of the growing fetus. Apart from that, serial assessment is required. Regular cardiology evaluations are needed throughout pregnancy, often every trimester or more frequently. And next is the symptom evaluation. Dyspnea, palpitation and fatigue overlapping with the normal pregnancy changes. Careful evaluation is required. Here we reach the medical management of cardiac diseases. Here there are some drug of choices which can use during the cardiac disease. These are beta blockers, examples labetalol and metoprolol. Second one is loop diuretics for volume overload. Third one is heparin, especially low molecular weight heparin for anticoagulation. Fourth one is digoxin in selected cases. Avoid teratogenic drugs, especially ACE inhibitors, ARBs and warfarin in the first trimester. Here I will explain about the management during pregnancy and labor. The first one is multidisciplinary team. The team includes obstetrician, cardiologist, anesthesiologist, neonatologist and ICU specialist. Next is the medication adjustment. Discontinuation or substitution of teratogenic drug is vital. The third one is labor and delivery. Vaginal delivery is preferred for most stable cases. Epidural for pain management reduces the cardiac stress. In some other cases, we can go for cesarean section. So these are severe aortic stenosis, aortic root dilatation, and acute heart failure. In case of anesthesia, we have to carefully select the drug of choice, which should avoid hypotension or fluid overload. Lastly, we reach the maternal and fetal risk aspect of cardiac diseases in pregnancy. In that, maternal risk include heart failure, arrhythmias and stroke, and maternal death, especially 0.4 to 1.2% in complex cases. The fetal risk include preterm birth, intrauterine growth restriction, stillbirth, and congenital heart defect. The postpartum consideration will be displayed on the slide. Please have a look on it. Here we can wind up our today's section. So in the next class, we will meet with another episode of midwifery topic. Till that, take care. Bye-bye.